Welcome to the NCM Orientation Part 5, Clinicals. This video includes NCM Clinical Forms, General Instructions, Trimesterly Reporting, Verifying Documentation of Clinical Experiences, Clinical Order of Completion, Clinical Credit, Experience in Specific Settings, Clinical Timeframes, Clinicals as Observer, Assistant, and Primary Midwife under Supervision, and definitions of active participant mastery and direct supervision. Document student completion of required clinical skills on NCM Clinical Record Forms. Instructions can also be found on each NCM Clinical Record Form, in the NCM Handbook and Catalog, and on the NCM website on the ASM Clinical page. You can download NCM Clinical Record Forms from NCM website's ASM Clinical page, or you can go to the following link. NCM Clinical Forms. There's Forms 1 through 11. Form 1 is 10 birth observes. Form 2 is 25 prenatal exams as assistant. Form number 3 is 20 births as assistant. Form number 4 is 20 newborn exams as assistant. Form number 5 is 10 postpartum exams as assistant. Form number 6 is 30 well woman or family planning visits. Form number 7 is 20 initial prenatals as primary. Form number 8 is 55 prenatals as primary. Form number 9 is 25 births as primary. Number 10 is 20 newborn exams as primary. And form number 11 is 40 postpartum exams as primary. You also need to complete the 4-page MEEC abbreviated NARM skills form. General instructions for completing clinical record forms. Write the student name on each form. Please list clinicals in chronological order. Print clearly. The preceptor must sign, not initial, every line. And please continue to use each form until it is complete. Forms at the end of each trimester to NCM to document progress, and retains the original forms to continue filling in. All clinical submissions must be accompanied by a student preceptor evaluation form for each preceptor. Verifying documentation of clinical experience. The student and preceptor must follow the guidelines in NARM's Candidate Information Bulletin, which can be found online on the NARM website, including but not limited to the following. The student's and preceptor's care at the encounter must be reflected on the client's chart via name or initials in case of audit. The student must have access to the original client charts for all births and procedures documented. The original client charts shall be kept by the preceptor. Client confidentiality must be protected by identifying them on these clinical record forms with a unique client code rather than their names, under client number or code, to reference the client chart, using one code for each client pregnancy. Clinical order of completion. At least 18 of the 20 births as assistant on form number 3 must be completed prior to beginning births as primary midwife under supervision, which is form number 9. There is no specific order of completion for the rest of the forms, though generally observes lead to assists and then to primaries. It is up to the discretion of the preceptor as to whether the student is competent enough to act as primary midwife under supervision at clinicals. All forms need to be completed prior to applying for permission to take the NARM exam or other certifying or licensing midwifery exams. Clinical credit. The preceptor will only sign off a clinical when the student has demonstrated the minimum required skill competency level for active participation versus mastery to the preceptor's satisfaction, as appropriate for the individual skills as defined on each clinical record form for each entire clinical experience. So in other words, just being at the clinical does not mean that you will get credit for it. Only the preceptor who personally supervised the clinical may give credit for that clinical. They cannot sign for another preceptor. With the exception of 10 birth observes, work done prior to enrollment or with someone who is not the student's official NCM preceptor at the time the work was done will not be eligible to satisfy program requirements. Students may submit additional clinicals beyond NCM requirements. These extra clinicals and clinical contact hours will be listed on the student transcript. However, credit will only be given for the required clinicals. During training as observer, assistant, or primary midwife under supervision, at least 2 must be planned hospital births. These cannot be intrapartum transports but may be antepartum referrals, and 5 must be home births. Out-of-country clinicals. When completing the NARM exam application materials, NCM students are not required to submit out-of-country or OOC birth sites Form 230 listed on Forms 200 and 204. However, 10 births as primary must be completed within the US or Canada to qualify for the NARM exam. Clinical time frame. Clinical experience documented on these forms must span at least 2 years. If a student completes the minimum number of each type of clinical earlier than 2 years, she or he must continue clinical training. All clinicals must occur within 10 years prior to the students passing the NARM exam, and 10 of the experiences reported on NARM out-of-hospital birth documentation Form 204 must take place no earlier than 3 years prior to the NARM exam. Student roles and requirements. NCM clinicals are broken down into observer, assistant, and primary midwife under supervision. Each of these categories has specific requirements for the student role, the preceptor supervision, and the student demonstration necessary to receive credit. Clinical requirements for observer. The student role of observer means that no preceptor supervision is required. Any witness can provide verification. The student demonstration necessary to receive credit is simply presence, the student's presence at the birth in any capacity. Observe form. It must include 2 hospital births that may not be intrapartum transports. For time frame, these 10 births may take place prior to or during enrollment at NCM, but must be no more than 10 years prior to the student sitting the NARM exam. This is the only clinical requirement that can be done prior to enrollment and without the direct supervision of an NCM preceptor. Observes completed prior to enrollment will not count towards the minimum 2-year clinical time span requirement. Clinicals as assistant. The student role is assistant to primary midwife. The preceptor supervision required is direct supervision. This means the preceptor must be physically present and in control at all times during the entire activity, must catalyze the important decision-making processes, elicit the student's rationales for her or his decisions, and oversee the student's charting. Preceptors may only sign off experiences which she or he personally directly supervised and witnessed. The student demonstration necessary to receive credit is active participation. The student must be actively involved in the clinical activity, including but not limited to charting, hands-on assisting, and participation in management decisions. NCM clinical requirements as assistant. The assistant requirements for NCM are on forms number 2, 3, 4, and 5. So there's 25 prenatal exams as assistant, 20 births as assistant, 20 newborns exams as assistant, and 10 postpartum exams as assistant. Form number 2, 25 prenatal exams as assistant. The estimated time per visit of a regular prenatal exam is 30 minutes. A prenatal consists of most of the following but is not limited to preparation, chart review, weight, blood pressure, pulse, fetal heart tones, baby's position, evaluation of size for dates, education and counseling for gestational age, specific topics, any necessary lab work, education and counseling for any discomforts, evaluation for need for referral to a social or medical resource, charting by SOAP method, cleanup, arrangement for next visit, filling out referral forms and lab slips. This form also requires 3 initial prenatals as assistant. Initial prenatals are estimated to take about 1 hour per visit. The initial prenatal consists of most of the following, but is not limited to, the same items as a regular prenatal, plus an intake interview, history, including medical, gynecological, and family, and a complete physical examination. These items may take place over several visits, but are counted by the student as one initial prenatal. Births as assistant. At least 18 of these must be completed prior to beginning the births as primary under supervision. A maximum of 2 of these births may be interpartum hospital transports. The estimated time per birth assist is 12 hours. A birth as assistant under supervision consists of most of the following, but is not limited to setup, assistance to the midwife in whatever she requests, assisting the mother and her family, participating and learning about charting, evaluating pre-labor, practicing admission, evaluation, and admission procedures, keeping track of progress and normalcy of labor, practicing taking and charting vital signs, counting baby's heartbeat, practicing evaluating fetal heart tones, practice providing comfort measures, preparing and coaching mother for actual birth, preparing mother's partner to provide comfort measures or to participate in delivery, practice assisting with birth and placenta, practice evaluating newborn response and vitals, practice assisting with newborn exam, evaluating the placenta for normalcy, practice with establishment of immediate breastfeeding, assisting midwife with cleanup, sterilizing, repairing, restocking, reordering equipment, making plans for a follow-up visit. Form number 4, 20 newborn exams as assistant. These exams must be done within 12 hours of the birth. The estimated time per visit is approximately 30 minutes. A newborn exam consists of most of the following, but is not limited to APGAR, gestational age assessment, reflexes, head-to-toe physical, application of erythromycin to the eyes and injection of vitamin K, metabolic screening, referral for hearing screenings, referral for pediatric follow-up, weight and measurements, footprinting, birth certificate, souvenir certificate for parents, registration for Social Security and Medicaid. Number 5, 10 postpartum exams as assistant. These visits must be done between 12 hours and 6 weeks following the birth. The estimated time for visit is 1 hour. A postpartum visit to mother and baby consists of most of the following, but is not limited to preparation, chart review for follow-up on such things as the need for ROGAM and ABO incompatibility, etc. Check baby weight gain, physical assessment and vitals, assessment of lochia, counseling regarding breastfeeding, bottle feeding, counseling and education for mother and family regarding nutrition for mother and baby, any necessary lab work, education and counseling for any discomforts, evaluation for referral to social and/or medical resources, evaluation of baby for dehydration, answering parents' questions, check health of umbilical cord and removal of clip if necessary, check healing of any stitches, tears, evaluation for need for referral to social and medical resources, charting by SOAP method, cleanup, arrangement for next visit, filling out any necessary referral forms and lab slips. Primary. Primary under supervision. The student role is primary midwife under supervision. The preceptor supervision required is direct supervision. The preceptor must be physically present and in control at all times during the entire activity, must catalyze the important decision-making processes, elicit the student's rationales for her or his decisions, and oversee the student's charting. Preceptors may only sign off experiences which she or he personally, directly supervised and witnessed. Student demonstration necessary to receive credit is mastery. The student must demonstrate competent and confident provision of safe, evidence-based midwifery care for the individual clinical skills, including etiology, sequelae, appropriate management and follow-up for the individual patient, appropriate times and reasons for consult and referral, access to relevant resources and information, complete, thorough, and timely record keeping, appropriate professional and compassionate management of every task involved, receptiveness and responsiveness to patients' concerns, explanation of midwifery decisions and actions as they relate to possible outcomes and their wider impact based on the midwife's model of care. NCM clinical requirements as primary under supervision. Form number 6 is 30 well-woman family planning visits. Form number 7 is 20 initial prenatals as primary. Form number 8 is 55 prenatals as primary. Form number 9, 25 births as primary. Form number 10, 20 newborn exams as primary. And form number 11, 40 postpartum exams as primary. Form number 6, 30 well-woman family planning visits. The estimated time per visit is 30 minutes. A well-woman exam consists of most of the following, but is not limited to preparation, chart review, complete physical assessment, including but not limited to bimanual exam to screen for colorectal and endometrial cancer, pap smear, collection of samples for STIs, breast exam and counseling on the following items: family planning, prevention and detection of STIs, nutrition and exercise relating to bone density, hormonal changes and physical and mental comfort measures relating to the interconceptual period and menopause, and attention to general social, physical, and emotional well-being, charting, and cleanup. Student mastery of the pap smear STI sample is required, though not every well-woman exam must include a pap smear. 20 initial prenatals as primary. The estimated time per visit is 1 hour. An initial prenatal consists of most of the following, but is not limited to preparation, chart review, intake interview, history, medical, gynecological, and family, complete physical examination, weight, blood pressure, pulse, fetal heart tones, baby's position, evaluation of size for dates, education and counseling for gestational age specific topics, any necessary lab work, education and counseling for discomforts, evaluation for need of referral to social or medical resources, charting by SOAP method, cleanup, arrangement for next visit, filling out referral forms, and lab slips. These may take place over several visits but are counted by the student as one initial prenatal. Estimated time per visit is 30 minutes for Form 8, 55 prenatals as primary. A prenatal consists of most of the following, but is not limited to preparation, chart review, weight, blood pressure, pulse, fetal heart tones, baby's position, evaluation of size for dates, education and counseling for gestational age-specific topics, any necessary lab work, education and counseling for discomforts, evaluation for need for referral to social or medical resources, charting by SOAP method, cleanup, arrangement for next visit, filling out referral forms and lab slips. Form number 9, 25 births as primary. Estimated time per birth is approximately 24 hours. At least 18 births as assistant under supervision must be completed prior to beginning this form. 15 of these births must include at least one prenatal, 5 of which must include full continuity of care and must additionally be recorded on the NARM Continuity of Care Practical Experience Form 200, which we will speak about later in this presentation. A maximum of 3 of these births may be intrapartum transports to hospital. Births as primary under supervision means that the apprentice demonstrates the ability to perform all aspects of midwifery care to the satisfaction of the preceptor, who is physically present and supervising the apprentice's performance of the skills and decision-making. The apprentice is present for all stages of labor and delivery and immediate postpartum, makes all clinical decisions for all stages of labor and delivery and immediate postpartum, is able to articulate the rationales for these decisions, and charts or directs the charting of all stages of labor and delivery and immediate postpartum. Please note that the student does not have to actually catch the baby in all cases. 20 newborn exams as primary. Estimated time per visit is approximately 30 minutes. This exam must be done within 12 hours of the birth. A newborn exam consists of most of the following, but is not limited to: APGAR, gestational age assessment, reflexes, head-to-toe physical, application of erythromycin to the eyes and injection of vitamin K, metabolic screening, referral for hearing screening, referral for pediatric follow-up, weight and measurements, footprinting, birth certificate, souvenir certificates for parents, registration for Social Security and Medicaid. Form number 11, 40 postpartum exams as primary. Estimated time per visit is 1 hour. These visits must be done between 12 hours and 6 weeks following the birth. A postpartum visit to mother and baby consists of most of the following, but is not limited to: preparation, chart review for follow-up on such things as the need for ROGAM and ABO incompatibility, etc., check baby weight gain, physical assessment and vitals, assessment of lochia, counseling regarding breastfeeding, bottle feeding, counseling and education for mother and family regarding nutrition for mother and baby, any necessary lab work, education and counseling for any discomforts, evaluation for referral to social and/or medical resources, evaluation of baby for dehydration, answering parents' questions, check health of umbilical cord and removal of clip if necessary, check healing of any stitches, tears, charting by SOAP method, cleanup, arrangement for next visit, and filling out necessary referral forms and lab slips. NARM clinical skills. The student role for each of these skills is primary midwife under supervision. Preceptor supervision required is direct supervision. Student demonstration necessary to receive credit is mastery. Completion of NARM clinical skills is documented on NCM's 4-page MEEK abbreviated NARM skills form. Completing NARM skills. The rubric for each NARM skill can be found in Pam Weaver and Sharon Evans' book, Practical Skills Guide for Midwifery. NARM skills background is taught within the academic courses. Preceptor demonstration, student practice, and evaluation of the student takes place in a clinical setting. 4 skills, numbers 66, 74, 113, and 136, require the evaluation and verification of 2 different preceptors. The time spent to master each NARM skill varies by the skill. Some skills can be mastered in 1 session. Others may require practice over many days or months. As with clinicals as primary under supervision, NARM skills will not be signed off as completed by the preceptor until the student demonstrates mastery of the skill. Submit photocopies of updated pages of the form to the college at the end of each trimester. Student keeps the original to continue filling in. Summary forms. These forms are not to document extra clinical requirements, but to summarize information contained on clinical record forms number 1 through 11 and NARM skills. Form number 12 is clinical requirement summary sheet. NARM form 200 is the NARM continuity of care practical experience documentation form. There's also the MEEK continuity of care documentation form, NARM form 204 out of hospital birth documentation, and NARM form 102 birth experience background. Form number 12, Clinical Requirement Summary. Use this form to track completion of all clinical requirements. There's space on the form to enter a date of completion for each of the other forms and requirements. NARM Form 200, Continuity of Care, Practical Experience. This form may be filled with clinicals that have already been entered on NCM Primary Midwife under Supervision forms number 7 through 11. Please use NARM's official version of the NARM Form 200 and read the instructions carefully, as this will also be part of the student's NARM exam application. The NARM Form 200, not the NCM Supervision Forms 7 through 11. All of the 5 births as primary under supervision listed on this form must include full continuity. That means each must include 5 prenatals spanning 2 trimesters, the birth, newborn exam, and 2 postpartum exams. Only approved NCM preceptors may sign this form in the spaces marked Witness. For 2 of these continuities, students are required to also complete a MEEC Continuity of Care documentation form. MEEC Continuity of Care documentation form. This form must be filled out for only 2 of the 5 continuity of cares listed on NARM Form 200, Continuity of Care. Send 2 of these forms to NARM with your NARM exam application instead of client charts. Do not send client charts unless you are asked specifically for them. Client confidentiality must be protected. See HIPAA guidelines. Student and preceptor must follow the guidelines in NARM's Candidate Information Bulletin online. NARM Form 204, Out-of-Hospital Birth Documentation. This form may be filled with clinicals that have already been entered on NCM Primary Midwife Under Supervision Forms number 7 through 11. Please use NARM's official versions of these forms and read the instructions carefully, as these will be part of the student's NARM exam application. 10 of the births as primary under supervision must be in an out-of-hospital setting and must occur within 3 years prior to taking the NARM exam. Only approved NCM preceptors may sign this form in the spaces marked Witness. NARM Form 102, Birth Experience Background Form. Use the births from Forms 1, 3, and 9 to fill in this form. Notes for filling in this form. In number observed, list births from form number 1, 10 births as an observer. In number active participant, list the births from form number 3, 20 births as an assistant under supervision. In number primary under supervision and number primary co-primary, use form number 9, 25 births as primary under supervision, divided in the following way. In the spaces for number primary supervision, list 20 of these births with a maximum of 2 IP transports. In the spaces for number primary co-primary, list the remaining 5 of these births with a maximum of 1 transport. Thank you for completing the clinicals part of the orientation. To continue with orientation, watch additional sections or contact the office.